In terms of working out a person's problem, where the difficulties they're having, the things that they can't achieve, you want to determine objectivity. If you do not determine objectivity, you don't have a baseline. You don't have a score sheet. You don't have anything to create a point of reference from. So this is quite vital. Now, I know about 95%, well, probably even 98% of physios who do not make objective measures during their subjective. This usually happens during the first 2 to 4 years, probably not 4. Probably in the first 2 years of a person graduating, or they're just learning the ropes, or they're seeing the changes within themselves as a professional. So in the first 2 years out as a professional, you're learning a hell of a lot. But sometimes this step is missed. So make sure you don't miss it. You want to make everything objective. So when the person says, Kusal, I'm a soccer player, I want to achieve 12 goals this season, and that's objective, 12 goals, 24 matches. Now, what else can we say to make this objective? I'll put down the PSFS worksheet here, which is the patient-specific functional scale. It is a functional scale that allows you to be very objective about all the information that you get. So, in the patient-specific functional scale, you can actually put down, I want to achieve 12 goals, okay? I want to achieve 12 goals at the end of the season. Now, you've modified the patient-specific functional scale slightly because the true patient-specific functional scale, what does it do? You list 5 things that the person can't do or they have difficulty with, and you give them a rating out of 10. 10 out of 10 being perfect, they can achieve it. 0 out of 10, no, they can't achieve it. But you can go ahead and look at everything a person says during the subjective and objectify it. So going back to the soccer player, you have the person saying, I want to achieve 12 goals this season. Okay, what do we need to do to achieve that? Well, his speed has to be at a certain level. His agility has to be at a certain level. These are all tests that can be done to help this person. The other thing that can help is all the ball skills. So the footwork skills a person needs. There's different footwork skill tests that you as a physio can do to help test this person out. Then there are also game-specific skills that people can do in terms of strength, in terms of agility. Some of these things I'm repeating myself, but you're getting the picture. You want to make sure that all the tests that you have got an objective test on it. You have got some kind of baseline on it. Objectivity. You need to make everything objective. You need to be able to measure everything. Very, very crucial, very, very vital.